Good evening, everyone. I'm Dr. Mike Cromer, president of the HCMA. And I want to welcome you to our second virtual membership event of the year, of my presidency anyway. Some of you still may be recovering from your Super Bowl hangover, but we're glad you recovered enough to join us tonight. We wanted to do our best to stay in touch with our members, letting them know of what services we're still providing. You hear from some of our leaders, and especially tonight, our special guest speaker, Dr. Michael Petit, which I'll be introducing later. We're hoping to resume our regular dinner membership meetings, which are, as you remember, done on a quarterly basis, with the next one being May 11th. So with progress hopeful, with vaccinations and the like, we'll hope to resume our in-person membership dinners by then. Please stay in tune and we'll keep you updated as time goes by. I'd like to welcome the other podium / screen members that have joined me tonight, fellow HCMA officers, Dr. Joel Silverfield, the HCMA president-elect. Welcome, Dr. Silverfield. Dr. Eva Crook, the HCMA vice president and chair of this year's Government Affairs Committee. Welcome, Dr. Crook. Thanks for joining us. We also have Dr. Bruce Shephard, the president of the HCMA Foundation. Hello, Dr. Shephard. And we also have Dr. Michael Petit, president of the Florida Medical Association, who screened all the way from his home in Venice, Florida, and will be saying some words to us later on. So I just want to say, as you know, this has been a challenging year for everybody, certainly challenging for the HCMA, but I am so proud and pleased with how the organization has responded to obstacles, responded to change, still keeping our mission in mind of being a service to our members and keeping the health of the community as our top priorities. Some things that have happened since last event that we had in November, which was our last virtual members dinner, is that we have strengthened our membership by bringing on Moffitt Cancer Center and the 300 plus physicians that work there as associate members of our association. So welcome, physicians, and we hope to, we know it will be a mutual benefit for both of us, and we hope to see some of you in the future, even in leadership and committee positions. But we're here to help and serve everybody, including the interests that you've brought to the table also. We also have, as you know, the vaccines got rolled out. The supply certainly hasn't been rolled out as fast as people would have liked, but the HCMA got on board and partnered with the Florida Physicians Alliance group here in Tampa, a group of independent physicians, to be able to provide the physician members of our association with vaccine for COVID as it becomes available. So we also have started up our legislative process. I won't get into too much detail. We'll let that be shared by Dr. Crook and Dr. Petit. But over the next couple months is when we're really going to keep up that part of our agenda with a luncheon and then also introduction of various bills and our legislative priorities. Well, at this time, I would like the 2 medical student scholarship recipients to join us by video. In February of each year, the HCMA and the HCMA Foundation are pleased to present medical student scholarship to 2 deserving candidates from the University of South Florida. And I would like to thank our present CPA firm, Rivero, Gordimer and Company, for continuing the tradition of being able to give our annual student scholarships that was established way back in 1979 and have been done yearly since then. Dr. Silverfield, will you please announce this year's recipient?
On behalf of Rivero, Gordimer and Company, HCMA's own CPA firm, who we're very happy with and we're very grateful for the relationship, I'm proud to announce the Medical Student Scholarship Award winner for 2021. Robert Mansour is a second-year medical student at USF who completed his BS in Biology of Global Health at Georgetown University in 2019. Since then, he has worked to embed himself in organized medicine, firmly believing It is the main avenue by which physicians can retain their autonomy and best advocate for their patients. Roberts currently serves as a delegate to the American Medical Association and is on the executive board and council of the FMA and HCMA medical student sections. He enjoys tutoring and mentoring his fellow medical and undergraduate students at USF and has a profound interest in helping to form and create future leaders within organized medicine. Robert has participated and volunteered in Tampa Bay Street Medicine, which is a fascinating student-run organization that operates mobile and stationary clinics for the homeless and underserved populations of Tampa Bay. It is my pleasure to present this scholarship to you, Robert Mansour. The HCMA looks forward to your continued involvement and student leadership. Mr. Mansour, would you like to say a few words?
Yes, I would. Thank you very much, Dr. Silverfield. It is an incredible honor to receive this scholarship. I obviously have a vested interest in the Hillsborough County Medical Association, given that I am Tampa born and raised, and obviously around the Super Bowl swelling with pride. And I could not be happier to be part of this organization. I hope to put the scholarship to good use as I further my medical career in the wonderful Hillsborough County. And thank you again so much for being here tonight. And obviously, Richa, it's wonderful to see you as well. I couldn't pick a more wonderful co-recipient.
Well, we're excited about watching your career go forward. It's going to be a wonderful ride. Congratulations.
Thank you so much.
Thank you. And Dr. Shephard, we now present the Matching Foundation Scholarship to the second recipient.
Thank you, Michael. A USF graduate, Risha Bish is now a second-year medical student at the Morsani College of Medicine and a lifelong Tampa resident as well. And as the president of the student section of the USF AMWA, that's American Medical Women's Association, and a delegate to the medical student section of the AMA, Risha is definitely passionate about promoting public policy and the advancement of future women physicians and learning how to better serve her community through advocacy and organized medicine. Through her work on the executive board as a member and coordinator of the just mentioned Tampa Bay Street Medicine Organization, an incredible effort, she's helped increase access to care for the homeless. Risha has led nutrition lessons for underprivileged children at schools and community centers for more than 2 years before recently co-founding a nonprofit project called Well-Fed Community. This organization encourages families and kids to adopt healthier eating habits through hands-on culinary experiences and information sessions. She looks forward to working with her colleagues to innovate healthcare in the future and find new ways to meet the needs of vulnerable populations. On behalf of the HCMA Foundation, it is my pleasure to award Risha with the Foundation's 2021 Medical Student Scholarship. Risha, would you like to say a few words?
Absolutely. Thank you, Dr. Shephard, so much for that lovely introduction. I'm so honored to receive this scholarship today and to have the support of the HCMA. I care a lot about Tampa and about the people here, and I'm excited to continue my journey at MCOM and hopefully serve my patients in the future better. And likewise, Robert, congratulations. Very excited. Thank you so much.
All right, guys. Wow, we had a number of well-deserving candidates, but these, as you can see, are the cream of the crop. What amazing things you guys are doing for your class, your school, your college, and the community. I guess somewhere along the line, along the way, you find time to study. But excellent job, well deserved. All right. I'm pleased also to announce right now the sponsors, our two sponsors for the evening, Shoemaker and Tower Radiology / Tampa General Hospital. Tower Radiology will not be presenting this evening, but I'd like to recognize them and thank them for their continued support for the HCMA throughout the years. Shoemaker, as many of you know, is a premier provider of legal services with a team of more than 270 attorneys and advisors. The Shoemaker's healthcare team serves as a benefit provider for the HCMA, offering our members discounted rates for their services. Please listen now as they present a 2-minute pre-recorded message from Grant Dearborn, who represents Shoemaker.
Hello, my name is Grant Dearborn, and I am a board-certified healthcare attorney with 20 years of experience in health law. I work for the Shoemaker Law Firm, and I live here in Riverside Heights. Shoemaker is an almost 100-year-old law firm and has a national presence. We are a multidisciplinary firm, meaning we can assist with many legal projects, including healthcare, compliance, litigation, employment law, real estate, transactions, and tax. We were just ranked the #1 law firm on the west coast of Florida by the Tampa Bay Business Journal. Our team understands that attorneys need to be problem solvers to meet the needs of our clients. My colleague, Jessica West, and I will be new participants in HCMA. We look forward to meeting you in person soon. Thank you for this opportunity.
Thank you, Grant. At this time, I'd like to introduce our special guest and speaker for the evening, Dr. Michael Petit, the FMA president. There will be a brief question and answer period after his presentation. During this presentation, if you wouldn't mind using the chat option at the bottom of the screen, directed to either all panelists or to me, and I'll look at the questions and present them to Dr. Petit after he speaks. So Dr. Petit, as you might know, is an ear, nose, and throat board certified physician who also specializes in head and neck plastic surgery. And he's been in practice for over 30 years in the Venice area. After earning his degree at the Lewis Katz School of Medicine at Temple University, he completed his residency at the Jackson Health System. And he served organized medicine in many different leadership roles, which include the FMA PAC president, vice president, secretary of the FMA, and a delegate to the AMA. He's also been on the FMA Board of Governors, District E representative, and he was the past president of the Sarasota County Medical Society. Dr. Petit is a fellow of the American College of Surgeons, but mainly what he does is he works tirelessly on our behalf, advocating for physicians and for patients in order to assure the voice of medicine remains strong. So at this time, I'll turn the screen over to Dr. Petit. Thank you for joining us tonight, and go ahead.
Well, I appreciate it, and thanks you everybody for joining. I've been busy, traveling around the state virtually, not in person, but the meetings are still the same amount, and we're still, meeting with everybody. And one of the things that I like to make sure that everybody understands is that our legislative agenda does have on its radar scope of practice expansion. We definitely are monitoring those bills significantly. We have one of the situations that with the pelvic exam bill that we're also looking at to try and make sure we make some changes to, because it's created some significant angst throughout the state. One of the things that I have been doing is during our fall Board of Governors meeting, we knew that the state budget and the state was going to be continually talking about COVID and how the monies are going to be allocated out, for the state budget to various different people. And we wanted to make sure that we passed a legislative agenda to be right there along the way so that we can gain significant advantages for our physicians. During last year, we put out a survey, and the survey showed that the 99.6% of all physician practices showed a decrease in their revenues. 94% had to apply for loans. 42% laid off people to a significant degree. 26% had to shut down their practices temporarily, and 4% closed indefinitely. And we were looking at this and we were saying to ourselves, oh my goodness, how are we going to provide, the people in the state of Florida with the health care that they need? and also bring forward, how to get these physicians' practices back up and running so that everybody can, provide the care that they need to give. So we look forward and started to decide, okay, what can we do? Well, one of the long-term situations that the Florida Medical Association has been looking for is to increase Medicaid payments to Medicare levels. Now, everybody that knows anything about the managed care organizations that are supposed to administer the Medicaid money, they're supposed to be paying us at Medicare levels, but they do not. And the reason that they are able to wiggle out of that is because there's no penalties for them not to do this. And this is just something that ACA has not enforced. So we're going to look to see if we can make that an improvement and get those back up. We're looking for one-time tax credits, for physicians in the state of Florida, so that they could get some money put in their pockets to make sure that they could keep their practices running without having to go to the bank and get more loans. The stories of loans being donated and getting for by the bank from all these practices, it's breathtaking to see around the state how this is going on. Continuation of care, everybody's seen what's going on with the unemployment in the state of Florida. Everybody knows that people have lost jobs. With the going of lost jobs, then they've lost employee benefits such as healthcare. So we're looking to see if we could get some subsidies to make sure that these people can pay their healthcare premiums, and then make sure that they are not uninsured along the way, so that when we do see them, they have some insurance. The telehealth initiatives that were placed into place, this was a godsend to several practices throughout this state. If it weren't for the telehealth relaxation and the parity for payments, from telehealth, a lot of practices would have gone completely under. And we thank goodness that they have been able to, keep these things in place. When it comes to the feds, they've, been able to say that we're going to extend this out past the pandemic. I think that once we have learned that this is an efficient way to provide care for patients in the state of Florida, that they can't go back. And we're going to have a tendency to look back at some of the bad telehealth provisions that were passed in the state of Florida and see if we could revisit that and make sure that we tidy that up along the way. State liability protections, everybody knows what's going on in that particular arena. If they don't, I'm going to tell you. There was one bill that was going to provide state liability protections for businesses and for medical practices and physicians. Well, in order to appease the trial attorneys, they broke them up. They put businesses on one and they put the medical profession and hospitals on another one. The business one's flying through committees without any opposition, and it's most likely that the business one's going to get passed. We've just now seen the reforms that are being proposed from the state Senate, and we do have some House committee bills that is out, but it's not yet particularly gotten a sponsor to see where that's going to head. However, it's going to look like it's going to be some pretty good significant improvements to state liability protections for us as we weather the pandemic and the decisions that we've had to make along the way to get people provided the care that they needed. Workman's compensation. This is interesting. If you developed COVID because you went to work every single day as a healthcare provider staff, and you're seeing patients on a daily basis, and you got COVID, the workman's compensation people said, well, you know what? You didn't get that at work. There's no way. You got that in the community. You got to prove that you got it at work under no circumstances other than that. Well, we're trying to change that so that, it's the other way around, so that the people can get, some workman's compensation protections. And we have reassurances from several senators and several House people that this is something that they favor, and it's something that they will, get in front of people. When it comes to the liability protections, we got the CFO on our side, just so everybody knows. Jimmy Petronis is on our side for that one, and he's been championing this, for us. Substantive state legislation, as everybody knows, the value of pre-authorizations. Pre-authorizations take up a lot of time. They're different for every insurance company. We want to make sure that we get these standardized so that we make it so that it's easier for us to get our work done. I mean, we are inundated with having to take care of people. We're taking care of people's families. We're taking care of people's, children. You're taking care of friends and family and keeping charts together and everything. So we can't go through, on a daily basis, 25 people trying to get our pre-authorizations under different rules. So we're trying to, streamline that. We want the transparency of the prior authorization requirements, to be made transparent. We want to eliminate step therapy and everybody's favorite, retroactive denials. You've been given the approval to do something, and then after it's all said and done, oh, we're sorry, they weren't protected or they weren't covered at the time that you did your procedure. So why did they give you the pre-authorization to begin with if they weren't protected or they weren't insured? They shouldn't have done it, and they know better, but they're doing it anyway. Federal legislation, just so everybody is aware, the Florida Medical Association has 2 federal lobbyists that we employ. Thanks to everybody's FMA dues, we are able to employ these people. And the invaluable experience that we get and the inside input that we can get from these people is unbelievably great. Last year, during the end of the year, we had the surprise medical billing legislation that came through. It dropped on a Friday evening, had 500 and some pages to it. Had some very unfavorable situations that were in it. Well, because of our lobbyists and our contacts up in Washington, D.C., we were able to make favorable changes in this law up until the last minute that this law got voted on and then got signed into law, under the previous administration and previous Congress. The E&M codes, same thing. We were able to make some changes that were going to be happening to them. Yes, there have been some cuts, but the major cuts that we were seeing that were going to come to people, in the state of Florida, on top of the pandemic cuts, that we all took, monetarily, were going to be astronomical, and it was something that we had to make sure we fought to, get, providers the needed money that they needed to protect themselves during this legislation. Obviously, we have federal liability protections. We want to extend the telehealth, flexibilities. We want to provide additional federal aid to states to the Medicare fee people for Medicaid. In fact, we were on a call with the Florida Hospital Association, and we're going to do a joint letter, Florida Medical Association, Florida Hospital Association, to see if we can't get Medicaid money to make sure that we get paid at the levels that we deservedly need. One of the things that I've been going around the state telling everybody, as committee weeks are going on, now is the time that we actually see the relationships that we made throughout our previous decade, that we watch what we're doing to get the relationships in various committees, leadership positions, and in the Senate and in the state. And if we weren't in the trenches with Jimmy Petronas when he was running for the House of Representatives, we wouldn't have Jimmy Petronas being an advocate for this liability protection as the CFO of the state of Florida, on our behalf. And he's pushing and he's breaking arms and twisting them along the way to make sure that we get these taken care of. So we have the House of Representatives. The next couple of speakers are very favorable, to us. We have the Senate President that is, on our side. The next Senate President, Kathleen Passidomo, has been very favorable to us. We have several committee heads that we make, leeway with. And the way we do this is that we make this allocations through the Florida Medical Association Political Action Committee. We are very fortunate. We only raise about $2 million per election cycle. Let's put this in comparison to the Florida Hospital Association and the insurance industry and the optometrists, okay? The optometrists raised $1.6 million for one issue. You know what they want to do? Operate and practice independently on the eye, legislatively and not through education. And we are having to make this done with just the $2 million for the entire state of Florida for everything that we do. The Florida Medical Association PAC has developed very significant relationships to make sure that we can move forward in this regard. And I would encourage everyone that has not been a PAC member to make sure that they join, at least at the 250 level. I encourage everybody to join at the 1,000 level. That's 500 per year, which is really not that much of a stretch when it comes to it, because if you look at the House of Representatives, the cheapest House of Representatives open seat that we have to get involved with is $600,000, and they range up to $1 million. And the cheapest Senate seat that we have to get involved with is $800,000, and the top one at the last time was $2.5 million. We don't even scratch the surface of any of these people, when we come into, play, with these particular, events. In this particular election cycle, because of the redistricting, we have to play in all 120 seats. We'll play in all the ones that are going to be even ones that are friends against friends because of redistricting. And we're going to have to play in all 40 Senate seats again, along with the cabinet, which is the agricultural commissioner, the CFO, and the governor. And we're also going to have the attorney general looking at us for, support and efforts. So anything that anybody's out there looking at, we are the leaders. We are the people that are out there. When somebody asks you specifically what's going on, what's happening, and you bring up these bills and you bring up all this thing, you have to bring up the relationships that we build and what we do around the state to make sure that we, make these things happen in our favor. And that is through our political contributions. And we would love to have as many people that are involved with even local races and key contacts, because let me tell you something, if you can pick up a telephone and you can call a key contact and we need their help, and they're going to call you back because you did some sweat and tears out on the campaign trail with them, okay, they are going to pay attention. And they're going to say, hey, you want to know what? I wonder what Eva thinks about this bill. And they're going to call her up and ask her before they make a decision on it. So it's very important that we keep these things going. Thank you.
Thank you, Dr. Petit, for joining us tonight and sharing with our members the things that are going on and the priorities of the FMA. I'm not sure how far along the workers' comp bill is, but if you can just give us some further insight, because that certainly sounds like it is beneficial to physicians' offices and their staff. Not to downplay any physician's involvement in healthcare, but certainly some physicians are still seeing people fully telemedicine, or their contact with patient isn't that great at all. But let's say they come down with COVID. Is there going to need to be some kind of proof that it could have been done by a patient, or are you trying to get a legislation that no proof has to be shown?
We're trying to get the legislation that, no proof has to be shown, that we got it as a job, related, something that happens because of our jobs and what we do on front lines. So what we have as far as things go, we're looking to amend the bill with this language because we're not looking to see if we could get a Senate sponsor and a House sponsor. And we almost had it amended to the business liability bill. And then Senator Brandis said, you know what, I want this to go through cleanly. And so he wouldn't allow it to happen. But we did get their reassurances that they like what we're trying to do, and they're going to do what they can to help on any other issue down the line that we could attach this to.
All right, I am looking at the chat column, and right now I don't see any further questions. So, Dr. Petit, I guess you're off the hook for now. Are you going to stay on with us though? Okay, if you stay on, if any questions come up, I may direct some things back to you. But one of the smartest things I did early on in my presidency was giving Dr. Eva Crook a phone call and asking her to become the chairman of the Government Affairs Committee, and working alongside with her this year in the committee. Let me just say, Eva, you're doing a wonderful job. Thank you so much for your persistence, your hard work, your knowledge, and your presentation skills. And Dr. Petit didn't steal all of your thunder, but you don't have to repeat some of the things that are going on locally, but you do have a few things I think you can share with our members of what we're doing on a local level.
Sure, well, thank you very much. I have a good mentor in both you and Dr. Butler ahead of me in terms of organized medicine, so thank you. The Hillsborough County Medical Association has our own local government affairs committee, and we tend to mirror our goals for the legislative session against the FMA's annual priority list. So we have those same priorities. Here locally, we really wanted to focus on prior authorizations for both medications and procedures and retroactive denials. Those are issues that really span across all specialties, all types of practice. So we thought they were the furthest reaching that really could benefit all of our members. And we also had a lot of luck last year with a local representative who supported retroactive denials. So we knew that that would be a good place to start. We've met locally as the Government Affairs Committee with 4 local legislators, Representatives Susan Valdez, Tracy Coster, and Mike Beltran, and then Senator Jim Boyd. Each of those meetings was really meant to educate on some of the issues that would be before them in regards to potentially other bills passed and driven by the FMA. We actually met first with Representative Valdez because we were hopeful she would want to sponsor a retroactive denials bill for us, and she did. It has gone through drafting and it's actually submitted already as House Bill 845. Thanks to our connections with the FMA, they were able to connect us with a Senate co-sponsor, Senator Gail Harrell, who's also been very physician friendly and also on our side in terms of retroactive denials. She had a bill last year that encompassed 4 total subjects, one of which was the retroactive denial. And this year, in the FMA's guidance, we thought to separate that issue out separately would potentially help it move through. With most of our meetings with legislators, once you explain the retroactive denial process, it really is a common sense issue that most people can get behind on our side, that there really isn't another example we can use from any industry where you can get an authorization and it can be retroactively denied. The bill is going to specifically ask for 2 things. One, that if we get an authorization, that a retroactive denial cannot happen at all. And if there's any other components where an authorization wasn't given or there was information that a patient was in their grace period, that the insurance company only has 1 year to then retroactively deny the claim. And so very straightforward and I think well written, and we're hoping to continue educating our local legislators here so they can be aware that those bills will be coming through the legislative session this time around. We've also helped to educate regarding the 2 very important things Dr. Petit has already mentioned, the COVID CARES package, which is the financial support for physicians in our state. The other side that I thought was very interesting, I learned from the study that Dr. Petit was quoting, as the amount of impact we have on the economy in the state of Florida, and the economy's regrowth and bouncing back from COVID is going to be very important. And just as an example, they have a statistic that the average Florida physician supports 14.8 jobs and generates $2.5 million in economic output. And so that means as a whole, Florida's physicians support 673,600 jobs and generate $113.8 billion in economic output. So I think with those statistics, we can really show that we're a large part of the economy, and education to our local legislators helps them to support those financial bills. And then lastly, of course, supporting telemedicine, educating our local legislators on the benefits just help to, again, support any bills they may see going through at both our level and then hopefully also at the federal level. We are going to attempt our very first virtual legislative luncheon this year. I believe it's been around 25 years that we've had a legislative luncheon each year where we've met in person with the legislators and their aides, and occasionally even some at the federal level are able to attend. And we present again our most important legislative priorities for the year, including the bills that we may have sponsored. This year we're going to do it virtually. It's next, 2 Tuesdays from now on the 23rd at noon, and we hope that we'll have a successful meeting this year.
All right. Thank you, Eva. Dr. Petit, I'm not sure if you've been looking at some of the questions coming through on chat. If you haven't, I'd like to direct one from Dr. J. Rao. And he says, hey, Dr. Petit, any thoughts on how as a medical community we can help address the vast healthcare outcome disparities that the COVID pandemic has highlighted? Any thoughts along that line? I think he may be meaning as far as the access to care, the knowledge of available care.
One of the things that, I've been looking at very specifically, and, Dr. Hansel Tukes is a infectious disease doctor down at the University of Miami. And he was the one that put the idea exchange for needle exchanges together. And he's been an advocate for making sure that we have outreach to these lower, and socioeconomic outreach, programs. They've been going with various different vans, et cetera, out to these various different communities to make sure that people, understand, what their healthcare needs are, what the vaccines are necessary, and, how we can, help these people, social distance, appropriate cleansing, proper nutrition, et cetera. And he's been doing a yeoman's job with this. And as the various different needle exchange programs are starting to get up and running throughout the state, you're seeing these are also doing the exact same type of stuff. So I think that is one of the things that we should just mimic and mirror and not have to reinvent the wheel.
Okay. As you know, and probably agree to, one of the heartaches we had of last legislative session was the passage of the nurse practitioners expansion of scope of practice. Can you give us a little bit of information of where that sits right now? Because of course it went into law. How many nurse practitioners are following that along to try to become independent? How many have done it already? Also, what's going on maybe behind the scenes with the Board of Medicine and all of this?
Well, the Board of Nursing is continually trying to expand their, their practicing, scope. And, we've been there all along the way. Mary Thomas, God love her, she puts through some of the most disturbing hours of testimony. If you ever had to listen to one of these, testimonies and what's going on, it is painstaking. And Mary sits there and listens to every bit of it and, backs on our behalf, what the law actually states. These people are trying to go outside what the law states. And we are constantly there telling them that they can't do that. They can't open that can of worms, and they can't go down that unless they go through a legislative process. One of the things that we have learned is that the scope of practice expansion as nurse practitioners is not as great and as broad as what they passed for the pharmacists. The pharmacists got a bigger scope of practice expansion than the nurse practitioners did,
Really?
with what they're able to do. And we've been having to fight along the way what they can do and what they can take care of, chronic conditions, et cetera. And the biggest hit that we got was, these pharmacists want to take care of congestive heart failure. I mean, let's be serious about this, we're trying to make sure that we keep everybody in the realm of what the law says and what the law, has passed, and making sure that they don't go outside of that. One of the things that I have been telling everybody that I have been coming in contact with, we don't ever want to see these bills cross the finish line. And the only way we don't get these bills to cross the finish line is to do what we are doing, okay, looking 10 years in advance at who's going to be in various different places along the way, what people we need to back up, what people we need to support, and which people we need to change with along the way. And then that point only can we stop these things from happening. And we're putting up significant roadblocks for the optometrists, trying to expand their scope, and on the anesthesiology nurse practitioners to try and expand their scope based on these issues alone for this particular year.
I know it is only 7 or 8 months since the legislation went into effect. Any ideas on the numbers of nurse practitioners that are striving or that have accomplished the independent nature of it?
At this current time, I don't have the numbers, but I know that there's not been that many, based on what they've been telling me, numbers wise. So, but they're just, it doesn't matter. Once they start to get their expansions, and they start to see what's actually going on, then more and more and more will apply. And we all know this, okay? It's just a matter of, okay, this was just a foot in the door, and it's just a matter of, moving forward from there.
Yeah, I know the Board of Medicine and the FMA is trying to keep Pandora's box closed. They got some of the key with the legislation, but there's a certain amount of things that we can still prevent from happening out of safety for our patients. Someone asked a question, and I wasn't clear on this either. You mentioned who got more, I think you used the word expansion of scope of practice was the pharmacist. Was that a separate bill than the nurse practitioner scope of practice expansion?
There was actually 2 separate bills that the pharmacist took.
Yeah.
One was a collaborative agreement that the pharmacist can have with any physician to be able to take care of chronic conditions. The other is that any pharmacist can look at and treat and diagnose strep, flu, chronic skin conditions, acute skin conditions, etc. I mean, it is amazing to me to watch, you know, what these people can do. And in this pandemic, I mean, people are going to be walking through Walgreens and CVS to get tested for COVID, touching things along the way and moving, you know, along the way amongst people. It is absurd to see what actually is, you know, has passed and to see what's going on. So it's been something that's been near and dear to my heart because, you know, ear, nose, and throat physicians, we see, you know, stuff like this all the time. And then we see the misdiagnoses, you know, that are made, you know, from these pharmacists, you know, on a almost daily basis. And we see them come into our offices, you know, saying, well, then they gave me this. And of course, out of every one of our mouths is, well, that didn't work. And the patient's like, yeah, it didn't work. That's why I'm here. So it's absolutely unbelievable what's going on, but we're keeping an eye on what we can do to, you know, keep it in check, keep it as much, you know, under bay as we can, keep it so that, you know, we're able to, you know, keep the physicians in the driver's seat when it comes to these things.
Mm-hmm.
Mike, I just saw that one about the liability.
Yeah, go ahead.
Reading about false testimony.
Yes.
This is something that is extremely interesting, okay? That bill passed several years ago. And at the Board of Medicine, they have not seen a single case of somebody that has testified falsely. Because when it goes through the administrative process, this is really interesting. They're not finding probable cause to bring it up with the Board of Medicine. So they're squashing it in the administrative process and they're not bringing it up to the attention of the board. So we have now been brought up a case that is a pediatrician that's going around saying that, you know, children are getting spiral fractures because of Ehlers-Danlos syndrome, okay? And they have brittle bones. And that's what he's been saying. And meanwhile, these are child abuse cases, you know, that are going through. And so we've gotten this case brought to us by Dr. Shephard, who's been, you know, one of the past presidents. He's a pediatrician, and you know, he's brought that up with us, and we're now bringing it up in the administrative process to see if we can get some of these cases actually brought up, you know, for what the law has intended.
Mm-hmm. Okay. I think you might have alluded to another question here. What's going on with the Balanced Billing Act and the ability for physicians to arbitrate with Maximus and the insurance companies?
Well, you know, in the state of Florida, that hasn't changed. That bill has that bill has not changed. We continue to monitoring what, you know, what is going on and what's happening. We're going to see if we can make some changes to that law to, you know, coincide with some of the changes that are in the federal law. Because it's kind of interesting when people come into your office and into your practice, they show you an insurance card and it doesn't tell you whether it's federally regulated or state regulated. And that's ridiculous because now how are you going to find out which one's which, you know, in your offices unless you start to dig into it? So you're not going to know which laws that you're, you know, going to be pertaining to. So we're going to try and see what we could do about making sure that the laws do actually, you know, coincide one another.
Mm-hmm. Okay. In closing up, I just want to announce to the members who are joining us by the webinar tonight or the membership meeting tonight that the nominating committee of the HCMA will be meeting shortly within the next week. If any of you have thought about wanting to get more involved in the HCMA on the county level, we are looking for people who would love to represent the HCMA, show interest in participating on a leadership level. So please soon, before the end of this week even, give myself a call or send me an email or let the staff of the HCMA know of your interest in becoming more involved in a leadership position. And I believe then that will conclude our virtual membership dinner for the evening. I hope that next time we meet, we'll be able to see each other in person and realize how much we've all aged in the last year, except me. And then Also, continue to join us between now and then in our upcoming webinars. And as a reminder, we have our 5th COVID Town Hall webinar next Wednesday, February 17th at 6 o'clock, where again, we have 4 of our HCMA members who are infectious disease specialists who will be our experts. And we'll be talking about the vaccines, present and future, talking about the viral variants, some other talk about demographics and the overall morbidity and mortality updates. So as always, it'll be very interesting. I hope that you can join us. If any of you were late in joining us and you missed any portion of the meeting, this will be taped and will be sent to the entire membership in the next couple of days. Until we see each other again, I wish everybody a good evening and be safe. Good night.